Hi, my name is Katerina Zaka. I'm an internal medicine resident at Wellstar Atlanta Medical Center. Today I'm going to be presenting a case series on orbital and ocular metastasis from neuroendocrine tumors. Neuroendocrine tumors of the gastrointestinal system are slow-growing, heterogeneous tumors with variable signs and symptoms, as well as biological characteristics. Neuroendocrine tumors of the gastrointestinal tract metastasize in 50 to 75% of patients, primarily to lymph nodes, liver, and bones. Metastasis to the eyes and orbits are rare, possibly occurring through hematogenous spread via the carotid and ophthalmic arteries. Metastasis to the orbit occur rarely in midgut neuroendocrine tumor patients, with fewer than 30 cases reported to date. Patients typically present with diplopia, proptosis, and decreased vision. Unilateral rather than bilateral involvement is more frequent, and the rectus muscles are often involved. Although orbital MRI remains the gold standard for imaging orbital disease, many orbital lesions are now detected on somatostatin receptor-based imaging, such as dotatate PET-CT. Patients with orbital involvement from neuroendocrine tumors typically carry an excellent prognosis, with 10-year survival rates of close to 40%, which is in stark contrast to the poor systemic prognosis seen in other malignancies when orbital involvement is detected. This makes local control even more important, particularly for symptomatic patients. This study is a retrospective chart review of the clinical presentations and treatment outcomes of 7 patients with well-differentiated GI neuroendocrine tumors who have ocular or orbital metastasis from 1990 till 2019. Institution board review approval was obtained, and patient data collected included demographics, pathology, type of therapy, and survival outcomes. Tumor primary sites included pancreas, small bowel, and unknown. A decrease in vision was the first manifestation in 1 out of 7 patients. 5 patients had an established diagnosis of neuroendocrine tumors prior to developing ophthalmic symptoms, and 1 patient had asymptomatic ocular metastasis. Staging MRI did not show any associated brain or leptomeningeal disease. Radiation therapy was delivered in 3 patients, 1 of which underwent surgery prior to radiation, and 1 patient received peptide radionucleotide receptor therapy. The other 3 patients were on surveillance with frequent ophthalmology exams. 3 patients had expired. 2 of the patients had next-generation sequencing performed, 1 with an ATM and CDKN1B genomic alteration, and 1 with no alteration. This table summarizes the patient characteristics and treatments utilized. The age ranged from 50 to 77. 4 were male, 5 were African American. None had a biopsy of the eye metastasis. Resection of the primary was performed in 2 patients, and 1 patient underwent debulk surgery. Then other covariates summarized in this table include the Ki-67 proliferation index, grade, differentiation, and treatment received. This slide demonstrates fundai photographs of the left eye and right eye showing multiple amelanotic metastatic foci to the choroid. Ocular metastasis from neuroendocrine tumors is a rare occurrence. Metastasis should be suspected when patients with neuroendocrine tumors present with eye pain or visual changes. Evaluation for such symptoms should include an ophthalmologic exam and cross-sectional imaging, preferable with orbital MRI. Carcinoid tumors are most likely low-grade neoplasms, and patients may have prolonged survival despite metastasis. Therefore, maintaining a good quality of life by providing early diagnosis and effective treatment to prevent visual deterioration and early involvement in palliative therapeutic programs may be as important as the primary treatment itself. Although primary orbital tumors require surgery, metastases to the orbit are associated with widespread disease in which other therapeutic modalities appear to be more appropriate. With improvements in non-surgical therapies, the role of surgery is minimal due to morbidity of diplopia and vision loss. The generally accepted treatment modalities for orbital metastatic disease are radiation and/or chemotherapy. In patients who are not radiation candidates due to the proximity of their orbital masses to other critical structures, or who are relatively radioresistant, systemic chemotherapy and targeted therapy are other options. Systemic treatment options include octreotide analogs, everolimus, sunitinib, capecitabine, temozolomide combination, and more recently, peptide receptor radionucleotide therapy. Physicians should have a high suspicion for ocular metastasis in gastrointestinal neuroendocrine patients with ophthalmic symptoms. All 7 patients with orbital or ocular metastasis from neuroendocrine tumors had evidence of other systemic metastasis, and their orbital or ocular disease were stable with no evidence of deterioration of vision. Thank you.